This is a pretty typical presentation of a person who's had a relatively recent disc injury. Now, I'm going to show you guys, because when I show you what happened afterwards, we literally call this fixing a disc. Now, you can just look at this picture and know that there's something wrong, right? Okay? It looks a little crooked, doesn't it? She's not exactly going straight up and down. Now, this is a situation where you could very clearly see, once you do all your homework, which is what we do in the technique I practice, you find out that vertebra is tilted. The ones below it look fine, but right there, right at L3, everything kind of tilts over, and then the rest is just all compensations all the way up. Now, when I say relatively recent disc injury, this patient was like this for months. And when she first came in here, she couldn't sit, she couldn't stand, she couldn't do anything. She was doubled over in pain, just basically crying the whole time. But when I took a look at it, I knew where the problem was. Now, after our treatment protocol, because I always re-picture the patient afterwards to see if everything's where it's supposed to be. This was her after 90 days.
Oh, wow.
Does that look better?
Yeah. Yes.
Okay. There's only one way you could accomplish this, and there's only one way physiologically you could accomplish this. You could see that L3 right there now is sitting nice and parallel on top of the bone as supposed to. Isn't that exactly what I was talking about? Get the nucleus back into place. As a result, the asymmetry in the joint now disappears, the nucleus is back in place, the annular fibers heal up, the pressure is off the nerve, the connective tissues will heal. More importantly, and this is the most important part, the function is back in that disc. And it's important because this is a relatively young lady in her late 20s. What would happen to this lady if we didn't fix that disc? You think maybe some degeneration, some bone spur formation would happen, arthritis. Maybe it's down the road, arthritis, spinal stenosis, scar tissue. I can go on and on. You know, what happens with pinched nerves, all the stuff that are associated with that. What happens if that patient was not taken care of? You think all this stuff would unfold in her life? This is why I'm saying that getting rid of disc dysfunction is even more important than just pain. It might even look like almost the same x-ray. It's not, trust me. But it's a similar set of physiology going on. Again, the discs all nice and parallel, everything good. Big giant angle, compensations. A lot of the same story taking effect here. Very important to recognize exactly which disc it is you're working on. And remember, we're talking about MRIs. Don't get me wrong, I'm a big fan of MRIs, but the fact that they're taken lying down more often than not really can be misleading as to exactly where the bad guy is. And that's what I like to call the bad guy versus the compensations. But when you preload it by standing, then you can see everything. There it is, right there. So, again, same person. Okay. Not bad, huh? Now, again, same question. What would happen if this patient was never taken care of? All those same things. Now, I want to show you guys somebody who is a little bit older injury, because I want to illustrate that you don't always reach perfection. It all depends on how recent your injury is. Does that spine look good?
No.
It looks like it's tilting. The Tower of Pisa comes to mind, doesn't it? Okay. Now, right here, this person happens to have an extra disc. Some people have 5 lumbar, some people have 6, but that's a different story. Right here between L4 and L5, there it is. You could actually visualize it. I got a little ruler that I use to see what's going on, but you guys don't even need it. If you look at it, you can see this is parallel, this is parallel. Right here is where everything tilts over and goes crazy. Now, all of the stuff that you can see right there is what we call compensation. Here is the same person 90 days later. Now, the reason I use this is because even though it looks a lot better, there's no doubt, it's not perfect. There's still some curvatures there, there's still some arthritis there. This is definitely an illustration of what happens when an injury is a little bit older. And you're not going to be able to get it to be perfect, but you can improve it a lot. Now, depending on how old the injury is, how much degeneration is going on, that scale will remain. So, I got one more I want to show you guys, because I want to show you guys that you don't always get disc herniations in your low back. Sometimes they happen other places. Can you see this person's head?
Oh, yeah.
All right, what are they doing? This is what they're doing. There is actually a term and diagnosis associated with that. This is what we call torticollis. Patients with torticollis, they're stuck like this. You call their names and they turn around and look at you like this. You think this is a comfortable way to live?
No.
She was like this for months when I met her. I've had a patient who was like that for years before I got to see them. This is a compensation for a disc problem right there. This was after a traffic accident. You can actually have a disc problem right there. You can see, yeah, if you measure the patient goes up nice and okay, then right here everything takes a wild turn to the left and it's all compensating, and all these muscles right here have gone to spasm in a splinting fashion trying to protect that disc. Remember, the body does cost and benefits analysis. Should I really go after protecting that disc and create this, or should I just leave it alone, let it all collapse and be paralyzed? What do you think it's going to pick? That's right. Okay, so now the patient's like this. This person, as well as another patient of mine, very presented similarly, they had gone to their doctor and they were injecting Botox into these muscles right here.
Oh, no.
Okay, Botox is basically the active ingredient in Botox is botulism. Okay, what does botulism do? It creates paralysis. They're trying to paralyze these muscles so the patient can stand straight up. It almost never works. They do it anyway because they don't know what else to do for these people. If you try to paralyze those muscles, it doesn't work. The patient's still like this. Why do you think that is? Well, you literally have to paralyze everything on this side of the body, because even if you were to be successful in paralyzing this muscle, the body will employ another muscle behind it, in front of it, and around it, trying to accomplish the same splinting mechanism. That's why it never works. You'd have to literally paralyze half the body for this thing to create enough. Well, even then you're not going to stand straight up. Well, as soon as we figured out where the bad disc was, is that looking better?
Yes.
Any Botox necessary?
No.
Any massive amount of muscle relaxants necessary?
No.
This is very important to understand, because when you're like this, like another patient I had, they take your driver's license away. You can't, basically your life is taken away essentially. You can't function. What are you going to do this way? So it was always considered to be relatively untreatable condition. It was like the syndrome. Anytime you hear the word syndrome, means we're not sure. That's basically what syndrome means. Torticollis, more often than not, is a splinting mechanism for a bad disc, which creates this sort of thing. And ultimately, what we have to do is restore function to that disc, and guess what? The body isn't stupid. There's no reason for it to keep you like this, and it needs to. Once we took care of the disc, we go, I don't need that anymore. Doesn't that make more sense?
Wow.
Okay. Is torticollis a disease or a side effect?
Side effect.
Is arthritis a disease or a side effect?
Side effect.
Is sciatica a disease or a side effect?
Side effect.
I can go on and on. As a matter of fact, this whole list down here, you could make a big giant argument that these are not really diseases, they're side effects. And don't get me wrong, every one of them has medication that's associated with relieving you of those symptoms with limited results. They sometimes do. But ultimately, it makes more sense to actually treat the patient in terms of cause. That way, you get rid of the effect versus trying to treat the effects for the rest of your life.